Hello friends, today's word is Ludwig's angina. Ludwig's angina. It is an acute, potentially life-threatening, toxic cellulitis, beginning usually in the submandibular space, and secondarily involving the sublingual and submental spaces as well. In majority of cases as arises are a result of dental infection. The prevalence of the disease is increased in patients with diabetes mellitus, organ transplantation, AIDS, and aplastic anemia. Patient shows rapidly developing board-like swelling of the floor of the mouth and consequent elevation of the tongue. Patient has difficulty in mastication, swallowing and breathing along with high fever, rapid pulse and fast respiration. Please like, share and subscribe to the channel. Thanks for watching and keep learning.